Welcome to the podcast. My name is Andre Wright. We're so glad for you to join. Today we have a podcaster, international speaker, and art practitioner, Sabrina. How are you today?
Good. Hey, Andre. Thank you so much for having me here. And thanks everyone for listening. You choose us and we appreciate you spending the time with us.
Perfect. And Sabrina, I was so excited to get you on the podcast because the issue that or the area that you're versed in as a healthcare practitioner is an area that we need to talk about. So to get things started, I want you to tell our audience about your background and how you got into healthcare.
Yeah, appreciate you. So I'm those typical busy bee, right? The people who doesn't stop. And I'm only child, only girl in the family of all boy cousins. So of course, the sense of competitiveness just goes since my early younger days. So of course, I'm the one who was like getting 2 bachelors, 2 masters, getting into medicine. And I was like, there's nothing else I want to do but surgery. And there's no type of surgery I want to do than heart surgery. I was also the one who, before I got my medical license and before I even finished PA school, I had 4 job offers in neurosurgery, cardiosurgery, vascular surgery, surgical oncology. Clearly, I'm the biggest surgery person, right? And then at the end of the day, I was like, wow. Heart disease is still the #1 cause of death in the country, and something that I have put myself in multiple rotations, blocks, connections with, and that's where I needed to go. So I got into one of the most well-known hospital in the country, and I was super excited. Start working, and we had patients fly in internationally to see us. So the sense of obligation and pride when you're in play with the higher level of where you are seeing where cardiac surgery are being built, it becomes something that you want to devote everything you got into the field. But that also means when you work with traditional old school docs, you don't stop, right? You're constantly going. And it seems like if you ever thought someone else is going to take care of your own thing, wow, that is so not acceptable. And if you are going to have more help, that means you're weak. So to the point that I remember by the time people get on vacation, whatnot, I was on call every day. There's 1 month I was on call for 29 days straight. I was working probably about 80 plus hours plus calls. One day I just couldn't even operate anymore because the day before I was still operating when I was sick. And finally I had the courage really tell myself I can't do it anymore. I had to take that sick day off. The response from my team was, oh, you didn't thought to tell us sooner? Like no one knows that I was sick already. So I felt like, wow, if we're constantly talk about eye care, right? The big thing about integrity, compassion to our patients, how are we treating ourselves and how are we treating our team members so we can actually sustain the work that we put into, the years of training we devoted into it. And instead of competing with ourselves and with the other people, what is the actual point of having this career if it's not just a title, if it's not just, oh, we were able to build this reputation, right? So I went back to my root in neuroscience and public health before I got into medicine. And really my research even back, more than 10 years ago, were on self-efficacy, self-care, which a lot of people misunderstand what that means, and efficiency, also stress management. And then devote more into performance science. So for all the executives, all the people who are big athletes, how are they able to function at that high level, intensive level, without going down the stress and burnout route? So I realized it's not that true we all burned out. That's not the status quo, and that's not supposed to be accepted. Truly, the issue is we have a leadership issue and decision-making issue.
Yeah. And the thing is, and as we're talking about earlier, doctors at times, they work so hard, and you're a testament of your background and what you've seen during surgery and the up and down and even in the COVID environment, right, where doctors they're working like 10 hours a day, or well, more than that, right? So the burnout is there. So I wanted to talk to us a little bit more of about the solutions. How can these practitioners avoid burnout?
Yeah, I think providers were natural problem solvers, right? And then we wanted to think that we are so good at learning anything, we can just solve everything. And that also same time creating more stress for ourselves because we are not necessarily talented or skillful at solving everything, but we want to. And sometimes we see ourselves as a Superman and Superwoman. In reality, we should just see ourselves as human beings. And sometimes we're human doings instead of human being. Right? So focused on what do I do? How do I focus? How do I just fix everything I need to? And so when it comes down to it, productivity and efficiency, especially when we go into the private side. Now, I fix a lot of larger organization of teams. How do I hire? How do we keep people satisfied? And it's the same thing with private. However, private side, I think because these owners, these practitioners have somewhat of entrepreneurial spirit. We're not just clocking in, clocking out, right? We're not just driven by all the RVUs to say what's our value base. And therefore, more sense of evaluating and be truthful to our own tendencies. So my core steps when we're thinking about capturing our time, how do we put in the least amount of effort to give you maximum result so that you can reduce the stress that either your internal expectation or the outside, right? Your patients, your team, your family is always asking to do something. And of course, that time, we're always scanning for fires, right? Like, oh my God, this happened. I have to solve this right now. Mm-hmm. Who the heck said that is the most urgent thing? And so when people say, oh, Sabrina, yeah, some people tell me I just focus on 3 big things for the day. I'm like, great. That should be done. But when's the last time you're actually able to do that? Focus on only on your 3 big things and not be sidetracked by something else that happens, right?
So Sabrina, so would you say it would be these practitioners, they don't plan properly? Is it the case of planning that's causing this burnout?
Part of it is that we get into a routine, whatever that routine is. And then we start going into a way of that's how I always done it. And that's what I'm feeling comfortable that I'm always doing it. So sometimes, even though you think you have a plan, you're not necessarily is the right plan for you. So one thing we always say is on a weekly and monthly basis, we need to rethink about what is the right track for you. And you don't know what's the right track unless you know what that end destination is. And that end destination has to be both what does your practice goal looks like, whether it's a revenue goal, a bigger community goal, right? Or perhaps is how many staff members that is supporting your team with a virtual care plan, with an in-person individual. How is that all play a part? And how is that connected to how you want to live? Who you are as a person, right? Your character, yourself as a leader in this field, everything needs to be interconnected. We stop evaluating ourselves when we start getting into this tutu train of, well, I have something set up, I'm always going, because I haven't allowed myself to even stop for a minute just to breathe. So if we can just give ourselves a permission to say, I have to stop, because if I don't know where I am right now, how I'm doing now, despite how much effort I am putting in to go forward, you actually don't know where you're heading.
No, that's true. So what about, I would say, systems and proper procedures that these practitioners, they don't have in place? So that may influence more burnout. Would you say that that's a big thing?
Yes, yes. One thing and one quote I love a lot is by the Four Seasons Hotel. When they think in their business model, they say we have to systemize the predictables so we can humanize the excellence. So what that means, what are the mundane, the obligations, the things that has to be in place, but we can create a system for that, whether it's automation, whether it's a specific team to train to do exactly the same thing all the time, so you don't forget a step in a way, or it could be something that you are constantly, a task comes in, immediately eliminate, right? Even that is a system. So I call that a freedom compass. So how do you create freedom? Now, first, we have to know what freedom looks like for you. So is that freedom of time, means you can do whatever things at whatever amount of time and how you want to do, like at what time of the day, right? What day of the month. So that's time. Or freedom of finances. So are you someone who actually have such a strong financial security that you don't have to blink your eyes when you make a purchase or thinking about additional things? Or freedom of people. You know exactly what type of people you want it to be your inner circle. And when they're not up to standard, you know what to say to actually let them go and not feel guilty about that. And the same thing, right? That's also for your clientele, that you're okay to say, I'm not going to help you if you're not going to help yourself. And then it's on freedom of location. Perhaps you want to be in the smaller town. You like that type of community, versus some people do want to be in these bigger cities, have the penthouse. And then what does that even mean to you? So if we can understand what freedom looks like, feel like for us, and then we can create what's called freedom compass. Now, freedom compass means what? Compass means it's a guide. Now it has 4 different areas. Number 1 is called the desire zone, right? We should, by the 80-20 rule, spend 80% of the time in our desire zone. Now, the mental barrier for a lot of us is thinking, well, I can't. I have so many obligations. I can't just do what I want to do. Now, it's not about what you want to do. It has to be 2 components. It's what you like to do, right? Your passion, what you naturally are engaged with, and your talent, your proficient. You have to be really good at it too, right? So for some practitioner, it could be you love to see patient. That's all you want to do, because you know how quickly identify what's wrong, what's good, what's progressing with their life and with their disease. And you have a great way of rapport, right? Building rapport with your patient, and then tell them exactly what to do next. And so they're willing to not only pay for your service, but keep themselves on track. Maybe so, that's your talent.
Yeah, and Sabrina, you eloquently speak about freedom and flexibility. Our practitioners listening us right now, and they're saying, Sabrina, what's your process?
Right. So this is the process. You have to create the compass first. So we just mentioned the desire zone. The distraction zone is also very crucial to understand. The task and the things that you do that are distraction means you feel like you like to do it, but you actually have no natural talent in. So for example, one of my client, he has multiple practices, and what he wants is distraction. He knows is that he feels like he wanted to have more financial diversity. So he started to really listening, researching on cryptocurrency, on how to invest in that field. Now, because that's not his talent zone, right? And then instead of hiring someone to do the financial investment for him, he is trying to learn everything himself. Therefore, you're going to spend a lot of time and still have to figure out how to best invest, right? And so therefore, it becomes a distraction because it's your passion, it's your interest, but it's not your natural talent. And therefore, the opposite tactic is another client of mine. He does really well for his practice. It's always hitting goals for revenue. And he's really good about building Excels, tracking all the numbers on the back end, right? Accounting side. but it's taking him a long time to actually gather all the data together. So our biggest thing for him was hiring a new accounting, because even though it's his natural talent to build and track, but he doesn't really like to do it, right? So you kill your momentum when you're in the zone of disinterest. And then guess what? The last zone is discouragement, because things feel like obligations, but you don't like to do and you don't have the talent to do. Versus you can find someone else on your team or hire someone to do that. But not surprisingly, most people who come to me saying, Sabrina, I feel like I have 80-90% of the things I don't like to do that's in that discouragement zone and not exactly in my desire zone. So when we can understand what type of tasks, what type of obligations are in all 4 zones, then we know where to focus our energy and time in the desire zone. Now, if we go into even deeper into the conversation, we may not have time in today's episode, but we call that a focus funnel, and there's only 5 steps. And if you can process all your tasks down to a funnel, right? Everything up front. Number 1 is elimination, right? Number 2 is delegation. Number 3 is intentional delay. And number 4, lastly, is deciding now. What that means is something that will produce your time and it's a long-term result. Therefore, you're going to decide exactly when, what time block to do that. The step up is to say intentional delay, because even though you can finish that in 5 minutes, multiple 5 minutes add up. So you're still going to be robbing your time wasteful, right? And delegate has a lot to do in our psychological tendency of what can we delegate? What's the good result? How do we train? So if we can understand our psychological profiling, there are 10 of them that supports and discourage us. Then we can also know how do we properly delegate. Then the last one, the really first one is delay, right? Sometimes it's so hard for people to say no, but what they don't realize is every no equals a new opportunity. So that's how true. Can we flip that switch? That's very crucial.
So and Sabrina, I like that. I like your process, and I know people are listening, and they will like that too. But as business owners, and I know as dealing with some practitioners, it's so difficult for them to let go. Right? They have this practice and they want to be involved in every little thing. And I'm agreeing with you. And that's a huge part of the burnout. But how would you say they can, they always say, don't try not to work too much in the business, but work on the business. So what are some of the strategies they can do right now to work on the business and scale it that way instead of working in it and burn out every day?
Right. So that means it go back to how do you define freedom? How do you define your desire? What is truly important for you? If your freedom is time, then your time has a price tag on it. Many people say, oh, my time is, you can't put a price tag. I'm like, oh yeah, you're going to put a price tag on it, because let's just use the earlier example. If your hourly rate is $200 and you're doing accounting work, which can probably cost you $100, you just lost $100, right? And that means you also decrease your efficiency by 50% instead of gaining that back. So if we don't know our value of our time, you're always going to get stuck on that, right? So same thing as how do you let go? You have to understand the value system of each task that you're doing. And then we also go very much in depth into psychological profiling, what's called positive intelligence, which is a cognitive behavior, neuroscience, performance science, and positive psychology. So of the 10 things we get into our own way, right? Number 1 is called judgment, and it's called our judger. Our judger always like, how the heck did you not make us this amount's revenue go as last month? What did you not do right? We start criticizing ourselves. And then we can be comparing, oh, did you see the person who you graduated with from school? They're already making da 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 da. They already have this and that title. We start judging how we're doing compared to other people. Or we start judging our team. Oh, it's because your team is too small, or this person is calling out sick too much, right? So when I work with people, I even make this happen myself, give ourselves a name for your judger, because it's not truly our own problem, right? It's just this persona that our brain created based on all this years experience. We don't even have to go into how we created this persona. We just need to know they exist, because the sooner you call them out, the sooner we can do what? Neuro remodulate, get yourself out of that place. Instead of most of the time, it's hours or days later, it's like, oh shoot, I guess I shouldn't have said that. It didn't come out this right way, but that person took it wrong already, right? And then when you go back to make the hatches, it's a lot more difficult, right? Then, all those review boards, these like case studies, right? Go back to, this and that. Why don't we just catch it way early on and then get ourselves into the better state of being more empathetic toward yourself and toward others?
And that's so true, Sabrina. I know, because I was researching and all you do, and you're known as the queen of productivity, right? And the queen of performance and productivity. From your perspective, would you say a specific what specific practitioner would burn out more? Would you, if you could kind of label them like a dentist versus a chiropractor? Are you seeing any burnout more in a specific with a specific practitioner? What are you seeing?
I don't think it's anybody specific, it's the individual specific. I think the subject of burnout is very differently experienced for individual. Now we can classify burnout for 3 different stages, right? Now it's codable for ICD-10. So the early stages, most people are just feeling fatigued, you don't sleep well, even you did sleep well, you still get a brain fog. It just always achy and pain, cough and cold symptom that never goes away. Now you go into the next level of start affecting how we think mentally. We start complaining a lot. No one helps me. This is always sucks, right? The thing is become more cynical toward everything. And so it's even more important to understand your 10 sabotaging tendencies and to pivot that back into the positive intelligence side. And then the deeper level, right? The worst level, level 3, is when people start always need to grab a drink and they start smoking more. And then the worst, when they start having suicidal ideation. We know the statistics shown before pandemic were already 200% higher in the healthcare industry than average American. Now, after the pandemic, they start showing even higher, right? And they see lack of support. And of the groups that have support, people are not actually reaching out to receive support. Right? It's because part of our identity, what we call that a high achiever sabotaging tendency, means we only have to see from the outside as someone strong, someone who always able to go, always able to achieve. And only when I can hit certain goals, then I feel that I'm worthy, that I feel like I am this type of person who can support my team, my community. And if I couldn't do it, then people must think I'm nobody, right? Who am I? And I think it's in this competitive field of nature of our society that causes us to put in this way. So we can't say certain specialty can have more burnout, perhaps, right? We do see some of them. And then certain specialty, yes, you don't have as many calls, you don't have as long of a clinic, and it could be a little bit better, but it doesn't minimize to say they wouldn't go into burnout. So I think it's something we have to see in an individual basis.
Interesting, because from the perception would be like an ear doctor would burn out more than like a dentist that goes in like 3 times for the week. But based on your perspective, which is very insightful, that it comes down to the individual and what they have going on and their environment.
Right, because you can say maybe their workload, right? The dentist who only has to do procedures, see patient 3 times a week. You think there should be less burnout, but what if their day is 12-hour days, right? 14-hour days. And then what if they have kids at home? When they get home, they're so exhausted and they barely can kiss their kids goodnight, and you have to restart the clock, right? So everybody's situation is different. I think the main reason I brought up in the beginning of our show is that we have to really see what's the goal for our practice, along with our life goal, with our personal mission. Everything has to be really puzzled together.
That great points, and thank you for that. And Sabrina, I can't believe time moves so fast. We're running now. We're definitely going to have to do another one. But I want to tell our audience, what are your top 3 books, or the books that you're reading now?
Yeah, so one of the books I always love and I got trained is by Brendon Burchard. So he wrote the book, the high performance habits, right? And then so that one is really breaking down to 6 core foundations for everyone. Another one of my mentor is Darren Hardy. A very simple book that he wrote, very short, is called The Compound Effect. So I believe compounding is not only for your tax, your finance interest, but we can compounding what I call the relationship economics. So we are compounding in each other's knowledge, time, and resources. That's how we can build a team that's synchronized, and that's how we can build referral partners with other providers who truly trust us, and they will cross-refer patients to each other, right? The concept of collaborate to accelerate. Now, the third one, usually I'm always listening to something, and then and sometimes these books then just go in and out. But another thing that people might be interested in, a lot of what I do is on positive intelligence, is by a professor from Stanford, Shazad, and positive intelligence really help you. We kind of mentioned the judger tendency, the controller, the high achiever. There's still 7 more. So if you want to dive a little bit more into what those profiling are, go for it, read that book. And I'm happy to have a more individual conversation on how do you get out of those each situation.
Perfect. And I love Darren Hardy. All right. So what keeps you up at night?
Oh, I sleep so well. There's nothing keep me up at night. I'm the one who's like fall asleep within 5 minutes.
That's a great answer.
I mean, I feel like for people who really keep at night and then they couldn't shut their brain down, that is actually one of the component of cannot have freedom, right? Like your freedom is, you can't be free from your own mind.
Yeah, that's perfect. And Sabrina, how can our audience, they're listening, how can they reach you?
I'm very active on LinkedIn. Feel free to send me a message on LinkedIn, or you can go to my website, sabrinarunbeck.com, just my phone name, and happy to have a conversation. You know, most people who come to me is because they are running a good practice, they're successful, but they're feeling like they're always have 10,000 things on their to-do list. They're always stretching thin, and they have more things they want to do, but they just can't fit it. Or they catch one thing, but they can never finish. I truly want everyone to know is you have the ability to have time back and be refocusing on making bigger impact. And when you leave your practice, things can still run very smoothly. And when you come back from vacation, you're not gonna have hundreds of emails. You're not gonna feel like all your patients show up the same day. And that's not life, right? We are truly going to be able to be a thought leader in your industry, but not dragging yourself down because of that title you put on yourself. So I'm happy to have a conversation. Go to my website. My calendar is up there. So you can grab a time and let's just have a chat, see how I can support you either by myself or all my entire network of trusted advisors.
Sabrina Runbeck, thank you so much for joining me today. Has been a pleasure. You dropped a lot of gems and important information for our listeners. And until next time, see you soon.
Thank you so much.